I'm Dr. Mimi Syed. I'm a board certified emergency medicine physician based out of the US.
Nice. And have you worked during wars or other crises areas or situations before you went to Gaza?
I have not. I've only done COVID relief in the US. Gaza, I've been to twice on medical missions, and that was my only conflict zone work that I've done.
And when were you in Gaza for how long each time?
My first trip was from August to September. I was there for 4 weeks. And then again, from the whole month of December, I was there, and I returned to the US in January in 2024.
Oh wow, those are pretty intensive times that you were there.
Mhm.
Um, now for like your entry, what was that like? What was the coordination like for you to enter Gaza? Was there like specific applications? Did you go through security? Through what crossing?
Yeah, so the when I went through, Rafah was closed, and you weren't allowed to enter through there. But I went through Kerem Shalom both times, and the entry process is very strict. It's not easy. You don't just kind of fly into Gaza and just get in there. There's no airport or anything there. But you go through Jordan, Amman, and you cross the bridge into LNB, and then from there drive to Kerem Shalom. And the whole process, once you get to the Israeli side, is very kind of intimidating and scary and difficult. Your things are searched. I saw people's phones being taken away, everything opened in their bags. And that's when, at the checkpoint, we have guns kind of pointed at us at certain times, and when we're putting our bags on the conveyor belt. So it's a very intimidating process. And then a lot of our stuff is mixed in. So when I was crossing, my stuff was taken out of the bags and mixed in with other people's stuff. So we had no idea if our stuff was taken out, if it was taken away. So a lot of people didn't know where their things were. And that's kind of the baseline of how things are there with us.
And were there like any infrastructure in Kerem Shalom, or was it like a table? Was there like a screen thingy that you go through?
Yeah, I mean, there's a screening kind of X-ray machine, but when I went the first time, it was very kind of like a temporary structure. But when I went the second time, there was more permanent structure erected. So there was like permanent bathrooms. There was a huge base right after Kerem Shalom that was not there when I crossed in the summer. And there was actually a highway right after when you cross into Gaza, which was absolutely brand spanking new, like paved highway that wasn't there before. So it's a permanent structure. But it's essentially a checkpoint where it's a second checkpoint, right? Because you get checked at Allenby and then you get checked again at Kerem Shalom before you enter Gaza.
Yeah. It's like the way that they think of it, you're entering and exiting Israel, which is
Yeah,
ridiculous. Yeah.
exactly. Yeah. That's it.
And when you worked in Gaza, did you work in multiple hospitals or did you stay in the same hospital?
Yeah, so the first trip I worked solely in Nasser Hospital for the 4 weeks. And then in December I worked at Nasser for a little while and then as well as Al-Aqsa Hospital. So
Al-Aqsa, that's in Gaza
Deir
City.
al-Balah.
Oh,
No, Deir
okay.
al-Balah. That's central Gaza. Yeah.
Yeah, yeah, yeah. Okay.
Yes.
And what motivated you to go to make the decision to go to Gaza and work there under severe bombing and attacks, shortages of everything?
Yeah, I mean, I think initially it was just the thing that compelled me is just my humanitarian side. I'm a physician, I'm a mother, and just a human being in general. I mean, I was seeing these images come out of Gaza, and these horrific images, and they just kept coming, and it was mostly children. And then I found out that most of the senior medical staff had been killed or imprisoned, and that the people that were working were trainees essentially. And I knew that I had this skill, that was needed. I have, trauma training. I trained in Chicago. I'm from Chicago. I worked in New York, and so trauma is not new to me. And so I thought, I could help in this environment. Um, but the second time I went back again, it was also, similar to that. But also, I felt, compelled to go back and expose what's happening, the truth, because the truth is very addictive. And I've said this before, is that, the thing about Gaza that draws you back is you get exposed to this unadulterated raw truth that is so hard to find in this world. that you become addicted because you want to show it to everybody. Because the things that are happening are just, it's so clear when you're there what the difference is between right and wrong. There's no blurred lines, there's no gray area. It's right, it's wrong. It's, there is a very a very distinct distinction made between what's right and wrong, and it's not about politics, it's not about religion, and that becomes very obvious when you go into Gaza, when you see for yourself with your own two eyes what's happening.
Yeah. Um, what do you consider the most prominent challenges facing the healthcare sector there? Is it shortage of medication, equipment, personnel, or all of them?
I mean, it's everything, but also, we can't ignore the elephant in the room, which is the constant bombardment and bloodshed that's happening. You can put hospitals up, you can bring medical supplies and aid in, but if you keep bombing it and destroying it and killing the people, then all of that aid is pretty useless, right? Because even if we do our job as physicians and save children, that child that I saved could be bombed tomorrow and killed by an airstrike or shot in the head, by snipers. So, aid is absolutely necessary. Now it's been 77 days since aid has entered Gaza. No food has entered. People are starving. I talked to my colleagues on the ground, and they're eating about 250 calories a day for an adult. That's impossible to sustain human life on that. And so, all of it is needed. Everything that you mentioned is needed. The basic human things are needed. Clean water, electricity, infrastructure, buildings need to be erected and the rubble needs to be cleared. All those things need to happen, but we also need to have a permanent and sustained ceasefire, because enough is enough. There's nothing else left to bomb. There's children. Those are the people, those are the casualties that have been killed for the last 18 months. It needs to stop. And that is actually the biggest problem, right? Because like you said, we can bring aid, we can bring all of the supplies, but we need to stop the killing.
Were the hospitals you worked in exposed to bombing during your work?
Yeah, so they would bomb. When I was there a week before I got to Alexa, the hospital was bombed. There were patients, burning alive in tents with IVs still attached at Alexa. A lot of us saw those images come out, unfortunately. And in Nasser Hospital, we got bombed right outside of the gates of the hospital. There was a car parked during a mass casualty that we were already taking care of. There was another mass casualty as a result of a car that got struck right in front of the hospital. So that was a constant thing. The bombs used to be, and still are, right in or around the hospital. And we saw recently Nasser's been bombed twice in the last couple months. I mean, so that continues. PGH, the European hospital, Al-Aqsa, again, were bombed in the last couple months. So that's not a new thing. That's been happening quite
Yeah.
often. We've all seen it. So.
And how do the hospitals continue to function under such like intense bombardment and attacks?
Yeah, barely. The hospitals that are the most functioning, quote unquote, most functioning, those are not really functioning hospitals. Those are not hospitals that we think of as functioning hospitals, right? They don't have the basic things like running water, soap, electricity. Those are medications to sedate patients for pain, antibiotics. Those are just basic things that a hospital should have to treat patients. Those things are missing. And so to call it a functioning hospital is, it's not accurate. None of the hospitals are fully functioning. So doing our job is impossible. But then also to add on top of that, the constant, mass casualties and children that are coming in dead, or severely injured. And this is an already malnourished population that even if you were able to provide some surgical intervention, they can't heal from their injuries. There's no protein in the market. There's the infection rate is astronomical. That shouldn't be happening, and it's all because the water is contaminated. The living conditions are so deplorable. The sewage is in the street, right? You have children playing in sewage. I remember taking photos and videos of children playing in the street in sewage. I thought it was water at first, but I realized and now he's talking to the locals. It was all sewage. And children fight this. And if you can imagine open wounds in this type of environment, you're going to have tear the infection. So, um, nothing kind of lends to recovery, nothing lends to recuperation of this population.
How are complex injuries handled given the absence of advanced medical capabilities? Like what,
That's
sorry, go on.
Yeah, go ahead, go ahead.
No, that's it. That was a question. You understood. I didn't
Yeah,
mean to elaborate.
I mean it's that's the important part, right? So when you had complex injuries, a lot of times you would let those patients die because you didn't have the surgeon specialist that to take care of it, or you didn't have enough blood supply, or you didn't have the antibiotics, you didn't have the room. A lot of times you didn't have a vent or an ICU bed, and so you would have to watch these patients die. And it's not just the injured patients. It's important to mention the patients that are coming in as a result of just normal, that illness that you would have in a normal community. I remember a lady I took care of, a 29-year-old woman that I actually wrote about too. She came in with her three small children in an ambulance and this was during a mass casualty, but she came in because she had a breast tumor that was the size of an olive, some months before that, just a small olive. And because we didn't have, the breast surgeon and the oncologist and the chemotherapy for her, her breast tumor was so large and deformed that it became so highly vascularized that it was bleeding out. And it bled out so terribly that she lost so much blood that he was in, shock, essentially. Her blood pressure was tanked. I ended up giving her 2 units of blood, but we couldn't provide the surgery she needed. And when I looked at her medical records, she had a type of cancer that was completely curable. Before October 7th, she could have received the chemo, she could have received the surgery. She was approved for medical evacuation, but denied by the Israeli government 4 times. And she had three small children with her that day. I remember they were sitting on the cot with her. And I was only able to give her 2 units of blood, but she would die later that day with her children right next to her. And it's something completely preventable. So we can't forget the regular, the kind of sickness and illnesses that you see in a community. That's also been destroyed, right? That care has been destroyed. Things that are preventable. People don't need to die from that. Diabetic ketoacidosis, something that's preventable. We can give insulin for that. It's treatable. We treat it all the time in this country and in the US, but the insulin isn't available. And if it was available, like in the summer, for example, there's no refrigeration for it. And so it's ineffective. And so people would come in and die because of diabetic ketoacidosis or kidney failure. I mean, I can't tell you how many children I saw die of just diarrhea because they lost so much volume of their body that they went into, multi-organ failure and died from something so preventable because E. coli is so high in the water, it's contaminated. And so every child had diarrhea. So those are things also that are very important because when you destroy a healthcare system from the foundation up, you also destroy the access to preventative care, and also to things that are treatable, because if your communities get sick, right, you still are going to have those illnesses. People are still going to have strokes and heart attacks and cancer and things like that. So you need to be able to still treat that, but you can't, not when you're dealing with an overload of trauma, these mass casualties. Everything gets distracted and taken up by that, and everything else is on the back burner. So yeah, I mean, it's unfortunately it's a death sentence to anybody who gets injured or sick in combat.
Um, I'm gonna pivot. How did medical supplies reach you, and how often were they available? Like, were there small batches? Did you know when they were coming, or like, did they randomly start showing up? Like, what was that like? The
Yeah, I
logistics.
remember only one day in both of my trips there. I remember UNICEF and a convoy coming in and bringing several boxes. And when I was at Nasser, I recall they said, well, I heard in the news that the Israeli government, the IDF, has allowed shipment in and supplies into Nasser. But when we went to look at the warehouse, it was completely empty. And just a couple weeks after that, that warehouse that was supposed to be storing the supplies that were coming in was bombed. It was struck by a drone. And the personnel that was inside, the staff that was inside maintaining that supply that was supposed to come in was dead. They got killed. And so this was a constant thing. We ran out of basic medical supplies, and there was a day at Nasser where we didn't have gauze. We didn't have sedation. We didn't have sterile gowns. And so we were kind of making our own gauze, makeshift gauze. There is no sterility, in Gaza. There's flies in the OR. The temperatures can't be maintained. And so this environment of, having a hospital that's functioning with supplies, that's just not there. That's not in Gaza. And the supplies that are needed, that are even allowed in, if they're allowed in, at this point, there's been nothing allowed in after this been on the stand. There's been no aid allowed in. But before that, when there were medical supplies, it was not even what's needed. It was just a fraction of what's needed. And, a lot of times in the summer, it was ineffective because of the temperatures, because of the high temperature.
Hmm. Um, are emergency service was emergency services provided adequately? Like, what was the capacity for rapid response?
Yeah, everything is rapid response. So mass casualty, let me give you an idea of what mass casualty incident is. In Nasser, when I was there, we would have multiple mass casualty incidents a day, every day. I was there for 4 weeks. I saw it every day. The majority of these patients, more than 70% were children. I remember my own statistic, which was about 86% of children. A lot of these patients would come in dead and then go straight to the morgue. So if this was happening, this was like every day, multiple times a day. That's an emergency response all the time, right? 24/7. And so actually the doctors there, the staff there are phenomenal. They know what they're doing. Even the trainees, they're amazing at what they do. They have trauma. They can write the books and all that. They've been doing this day in and day out for 18 months. They don't get paid. They're all volunteers. And they know their medicine very well. And they're working in an environment with extremely scarce resources. And and what happens in an environment like that is you have to kind of decide who lives and who dies, right? You have to use your resources in a way that go as far as they can. And unfortunately, that was very common, is to let people basically have palliative care, let them die because the resources you were using for them would be, quote, wasted. And you can use them for someone else who had a better chance of surviving or had a better prognosis. A lot of times, head injuries, for example, open head injuries, open wounds to the head or brain that are out. Those were patients that would be marked as someone you could not salvage because the prognosis and the outcome for them would be so poor because of all the things I mentioned, the infection rate, all of those things, and the lack of surgeon, that they would end up succumbing to their injuries. And so, that's kind of where things would stand with mass casualties.
Um, um, were you ever, while you were in Nasser and Al-Aqsa, were you under evacuation orders at any point?
Not while I was in the hospital.
Okay.
There were evacuation orders for people all around the hospital. I mean, a lot of the time. In fact, many of the injuries that we would have were from this particular type of shrapnel. It's a cube-shaped shrapnel that's made out of tungsten with a very high melting point, and those would be shot from a drone that would spread out during mass, evacuations. And it was at times where people were congregated. Children would be playing a soccer game. We would be seeing these incidents, these type of injuries come in during those times. Many of them were during evacuation orders.
Wow. So, like, evacuation orders were some of the most dangerous times for people to be doing anything while
Absolutely,
they were
because
being
you have
displaced.
a exactly because you have a large group of people, and you can do the most damage because they're outside and they're exposed. And these little tungsten cubes are extremely damaging. They have a very high melting point, like I said. So when they enter the body, they basically liquefy and cavitate everything in their path. So they destroy anything that they end up in. So if they get into your liver, cause such massive bleeding, especially in children that have very small structures. And so most of these patients, when they would come in, they would be dead. And that's, how to do the most damage.
Yeah. Um, okay. Um, so now I'm going to talk about freedom of movement. Just- That's the title. Um, did you face difficulties in transporting the wounded and injured from bombing areas to the hospital? Were you a part of that, or were you stationed in the hospital mainly?
No, we were very much a part of that. On my second trip, when I was at Alexa Hospital, there's no CT scanner. There's actually a part missing that's not allowed in to enter from the Israeli government, and so they don't have a functioning CT scanner. So when patients would come in, we would have to stabilize them, do the best we can, and then transport them in an ambulance to another hospital that was not in a safe zone or quote safe zone. None of this was nowhere in Gaza is safe, but this was in particular outside of the safe zone. So we would have to sit in the ambulance with the patient. And I remember a young boy that came in that was 8 years old that had a shrapnel injury to his face, and his whole face was basically sliced off. And his airway was compromised. So I went on the ambulance and kind of stabilized his airway so that we can get him from the hospital to the CT scanner, which was at another hospital. And the ambulance ride it wasn't just one patient, it was several other patients that were critically ill in the same ambulance. And we were going to the CT scanner. But during that ride, I remember it was a very difficult ride. So obviously there's rubble everywhere. So the ambulance can barely get through the roads. So it takes longer. But then also there was airstrikes all around us when we were going. And so we were afraid of being struck ourselves. We would hear the drones, we would hear, bombs all around us. And so we would get it to the CT scanner, and it was always, are we going to make it back or not? That was something that happened day in and day out. There were so many patients that would be injured in an area